Lawrence, Odina, Antotemo, Kede, Ekicholomoyo, Ekuya Yakede.
My name is Dr. John Erus, Deputy Governor of Turkana County. Turkana is one of the counties that has tremendous opportunities and tremendous challenges in areas of water, education, health, livelihoods in general, and that is partly because of climate change, the stresses and shocks created by climate change in the livelihoods of the Turkana people requires compounding interventions, and that is why one of the things that the county government of Turkana leadership, in line with the 9-point agenda of His Excellency the Governor, is to consolidate all the efforts of our development partners into key value chains. We believe that the cooperation between the national government, development partners, usaid programs, and especially usaid, nawiri, reducing machinery initiatives, is a skills-based intervention that reaches out to the local community. And in realizing that the skills development at the level needs to be sustained, we are working with our development partners, usaid and nawiri, for example, to support the value chains that are likely to attract both, to spur both development and attract investments. We have had several discussions with other private sector development partners. We have also had discussions with a high delegation from U.S. Development Finance Corporation, who also met with the USAID team in Nairobi. And those efforts are geared towards ensuring that the skills that you have witnessed today, the optimism of the individuals that have been able to benefit from those skills development is really why we are here. So we want to make sure that the boats that are, the fiber boats that are being handed over today is aligned with the fish and fisheries value chain. That is the only way we think the skills that have been provided and the progress that is being made through those initiatives along the lake region will make sense. The other area is looking at how we manage the impact of climate change. Yesterday, the Secretary, Assistant UN Secretary General Rina is in Turkana County, again looking at how we can work together to develop interventions that are going to make people resilient in the changing times of climate impact. And so really why we are here is to translate all what we have learned from usaid nawiri interventions into value chains that is going to support our future for communities and communities in Turkana and general.
What measures have we put in place to ensure there is no duplication of this?
One of the things we are doing is to make sure that there is no duplication of projects. Is we have a department on resource mobilization, Directorate of Resource Mobilization and Geo-Coordination. We have mapped all the partners according to their contributions to our 9-point agenda. We are also working with IFC to make sure that we translate those 9-point agenda into key deliverables with very clear socioeconomic outcomes. So that will be a pathway for why we are establishing ways to make sure that we support the value chains that are critical to improving the people's lives. We have already identified 5 through the initiatives that the government engaged with the Kenya Natural Research Institute, and those value chains, 4 of them are demonstrated in the skills that we have witnessed today.
Majina ni Felix Rota Call, niko kwa group ya mechanic, nawiri ndio imetupa hiyo nafasi katufunza hadi tumepata hiyo ujuzi. Sasa hii tunaweza tengeneza pikipiki hapa Lomekwe. Kitambo ilikuwa pikipiki kiharibika hapa inapelekwa Lodwar ama Kalokot. Lakini sasa hii tunaweza tengeneza hapa Lomekwe. Tunaweza fungua engine ya pikipiki na tutengeneza. Imetusaidia juu kitambo ilikuwa tunapeleka mbali, lakini sasa hapa hivi tunapata pesa. Eleza. Tunapata bure, nawiri ndio imetusaidia kupata. Maisha yangu tabadilika. Nimepata ujuzi na nitatumia ujuzi kupata hiyo pesa. Watoto watakuwa, mandugu yangu watakuwa wanakula chakula tofauti tofauti. Kama ni shule watalipia. Sitakuwa nyuma kama vile nilikuwa
American people to donate an oxygen plant to support Lodwar County Referral Hospital. That hospital
to launch 8 fiber glass boats. These 8 boats are going to benefit about 1,000, just over 1,000 program participants. We have trained a lot of these youths on how to operate this, but our investment is more than 253 million in the fisheries sector. That includes the purchase, procurement of these motorized boats, but also other equipments that have been given to several youth groups, including net making, equipments for basically for the fisheries sector. But the 1,000 participants who are going to benefit from these boats have also benefited from other layered activities, including access to financial services, business trainings, financial literacy, as well as how to make products out of fish. So they are not just going to to the lake to get the fish, but I think we have literally built on the other requirements, including trainings and capacity building. Nawiri has established more than 3,700 groups of youth, mainly adolescent boys and girls, with each group having 30 members. That means more than 100,000 youth groups, individual youth members are basically benefiting from different varied skills. Today we have seen a lot of youth who are showcasing their skills in different aspects, different skills, such as electrical engineering, mechanical, dressmaking, boat making and all that. What is really important to note is, as much as we are handing over these commercial expensive motorized boats, as part of our sustainability, we have also trained youth groups, particularly along the lake, in terms of how to make local boats. And I'm glad to report that at least the first 3 locally made boats have already been sold at the Kenyan shillings 80,000 each. So that is going to make sure that the local fishermen are able to access low-cost, cost-effective boats in this part of the country.
How much money has been invested by Nawiri in these boats and entirely in Turkana since you started your projects in Turkana?
So this is an 8-year program generously funded by usaid for about 145 million USD. 70% of that resource actually comes from Turkana, and about that percent to some. And the reason we have 70% of our resources here is because of the footprint that Nawiri program has in this country. We are currently working in 262 village clusters. What we call clusters is basically more than one village, targeting more than 471,000 individual participants in Turkana. This is roughly about 70% of the population in 23 wards, and we are going to expand to 2 additional wards in the coming months, which means we are going to target 25 out of the 30 wards. So you can imagine the footprint of Nawiri across. Today we have seen youth groups who are basically both adolescent girls and as well as boys, showcasing the farm produce. Nawiri has opened up 16 irrigation schemes where large-scale farming is taking place, in addition to several other agri-nutrition and fodder production sites. Currently, we have covered about 68,000 hectares of land that is fully under cultivation, basically on cereals, vegetables, fruits, as well as fodder production. You can imagine the income that is going to be accrued from this 68,000 hectares that is fully under that. Of course, in addition to that, Nawiri supports 66% of the community health units in Turkana County. It's about 160 plus. And we have also trained and built the capacity of more than 1,600 community health promoters, whom we have trained, built their capacity, provided them with the relevant equipment so that they provide services to last mile communities where access to health facilities isn't possible because of the distance and all that. But also Nawiri has invested more than 384 million Kenyan shillings on ultra women groups, where we have established more than 2,400 groups, business groups of 3 ultra poor women. So that takes you about, in last mile community. So each of these more than 2,400 groups have received business startup and have also received what we call consumption stipend, and basically to cushion them against the recent round. So we have spent roughly about 284, 286 million basically on that component alone.
Mbili, tatu, makofi.
First, I want to welcome the team from usaid. We really appreciate what is happening. I've had a chance to make a visit to a number of projects funded by nawiri, and I can testify and confirm that we have success stories. The livelihood projects that have been facilitated in Turkana North, like the irrigation scheme, like the water project in area in Kaiko, where besides domestic use for domestic, there is some irrigation of some horticultural crops. I have come to Natuo, a project, a major project that is going to, change the fortunes of communities around it to do irrigation. So a number of them, the ones I've visited, have very good progress, and the impact is huge. So we really appreciate what nawiri through the Foundation has done for our community. Of course, that is not enough. We're looking at partners and governments to see how we can deepen this relationship and see how we can scale some of these projects going forward. I know, and I talked to the team one time, that the irrigation scheme in Naduna can be scaled. It can cover many more acres because the area is good, the soils are good, and we can do not just sorghum, we can do maize and many other crops. There's much to be done, but what has already happened is extremely tremendous progress. And as a member of parliament, we've been able to engage communities, and the stories that are coming out from the beneficiaries of this project is a huge success. Thank you very much.
And the groups that you have seen today exhibiting a lot of the skills are some of part of the 749 youth who have graduated through our youth machinani in Turkana North, with additional almost 1,200 currently doing the same skills in the north. The foodstuffs that you have seen come from about 68,000 hectares of land in 16 irrigation schemes that Nawiri has revived, in addition to several others agri-nutrition. In the Fit for Nutrition alone, which is basically the last mile shops that you have seen, we have spent about 380 to cushion them against that.
I'm David Gosling. I'm the head of USAID here in Kenya. So we're part of the embassy, and we're the part that enables the partnership between the American people and the Kenyan people. A year ago, I came up and I met with the Deputy Governor, and we celebrated the supply of oxygen production facilities to the hospital here in Turkana. We talked about the need to deepen our partnership together to meet the needs of the people of Turkana in ways that provides them with income, improved nutrition and health outcomes, and creates that prosperous family that we all support throughout here in Turkana and more broadly. So we sat down together, our teams, and we came up with a plan. First, that was enabled through $1.1 billion, billion Kenyan shillings of drought assistance. as part of a broader 2.7 billion Kenyan shillings effort to improve the households and livelihoods of so many families here in Turkana. But I needed to come here and see it myself, to see the progress that had been made in that partnership, to talk directly to the women's groups, the youth groups, to the entrepreneurs that are benefiting from that assistance and working together, to see the boats that are being launched today, and to hear directly from the community workers who are a central part of that. Because it's the community workers who put together the program at the ward level, the strategy that identified the needs of the people here in Turkana. And that's what we partner together with the Deputy Governor to help implement. So that's why you see today training programs for people that are doing electricians, plumbers, cell phone repair, people who are producing honey, people who are producing hay, all of which who have increased their incomes and now have savings that they can use for their families to enable them to have more nutritious outcomes, but also to adapt to challenges that may come in the future. And that's what we're here to do, because that's part of the partnership between the American people and the Kenyan people, because we're all better off when every family has the ability to put money in their pocket, food on their table, and have healthy, nutritious outcomes for all of them. Thank you.
Maybe based on what you have.
This progress, but still more to do. So for example, not long ago, only 3% of the households in this area, it's estimated, had the nutritional outcomes to have fully healthy families. Today, that percentage is over 27%. That's a tremendous amount of achievement, but also underscores there's more to do. That's why we're here today, to talk about the achievements that we've made, but also how we can continue to partner with our partnership at the county level, and also with other donors in organizations, such as Mercy Corps, who are here today, and so many others that are working together with the people of Turkana to achieve and continue to make improvements on nutritional outcomes.
Yes.
This project is somewhat unique in that we have multiple measurements, because what we're trying to do is build resiliency, and that requires a whole host of things. That includes, as we talked about, improved nutritional outcomes, but also means that households need to make sure that they can derive a certain amount of income to meet their family's needs. It also makes sure that they can keep their kids in school. It also means that they have to have access to quality healthcare services. So we have benchmarks that we've established that are based, as I mentioned, upon those goals and objectives that the wards themselves identified in terms of the outcomes for each one of those areas. That's why I mentioned already the improvements that are being made in nutritional outcomes. We measure those. We also take a look at improvements in health outcomes. So for example, diarrhea and dysentery have been cut by 1/3 over the last couple of years. So from about 27% down to 16%. So again, the story there, tremendous progress, more to do. And that's been enabled by improved access to sanitary services. That has improved from about 7% to 26%. Again, tremendous progress, but more to do. But I want to emphasize, how do we do that? We work directly with the county office, the wards, the people, the communities here, to identify the ways that they have identified the best ways to improve their incomes, their health outcomes, and their resiliency now and in the future.
Thank you.